welcome. Thank you all for coming and being here today. My name is Amanda Villaveses. I am the Director of Mental Health Blue. And if you're not familiar with Mental Health Blue, we are a community mental health wellness hub. And Mental Health Blue was started in around 2018, 2019 as a way of connecting the community to the providers that we have within Louisville and surrounding areas. So what we noticed was that we have a plethora of resources in our community, but people don't seem to know how to access them, which is why we're here today. We've been building this database for providers for a while now, and we're continuing to build it and develop it as a way for people to have easy access to the providers in their community. And we're able to use this database to help people find a provider for them, and if they aren't able to find who they need on the database, they can connect with us directly so that we can help demystify this process. So one thing we know is that if you haven't experienced some kind of anxiety or depression or mental health issue in the past few years, you're pretty lucky, because we've seen increases of depression and trauma, things that are still people carry with them every single day, even as we're kind of getting back to some semblance of normal. And we want to make sure, with our partnership with public health, that we are able to help the community access the resources they need to help with healing and to help them process some of these things, and also just break the stigma that mental health, is something for not for me, it's for other people. It's a problem other people have. We want people to recognize that it's a very normal experience to have mental health issues at some point in your life. And so, with that, I want to actually bring up one of the providers who's listed in our guide, who's been a great partner with us throughout the years. I want to bring up Lauren Muir of Martin and Muir Counseling, and many, many other things.
Right. Thank you, Amanda. All right. Good morning, everybody. So my name is Lauren Muir, and I'm a licensed professional clinical counselor supervisor. I'm also the co-owner of Martin and Muir Counseling, which is a mental health agency here in the city that primarily services youth, adolescents, and families. We say we do a non-traditional type of therapy because 98% of our work is done in home, school, and community-based settings. We primarily serve West End Louisville, so over 76% of our clients reside in West End Louisville. I'd say about another 12% are in South End Louisville. So we really try to gear our work towards breaking the stigma and bringing mental health in non-traditional settings or communities where people usually don't have access. Over the past 3 years, we've had a unique experience because we started in 2016, but in 2019, we grew our clinical team and added therapists and case managers. And then shortly after, the pandemic hit, and then there was civil unrest in the city with Breonna Taylor, and things have just grown ever since. So one of the things I wanted to talk about is what we've seen. So we've definitely seen an increase in depression and anxiety, as Amanda mentioned. Definitely an increase in trauma, and also an increase in grief and loss. And that is from a wide variety of things. So one being the increase in suicide rates over the pandemic or over the past 3 years, and then also an increase in adolescents and youth is who I mainly work with, but they have lost people to gun violence, whether that be their friends, family members, or people just in their classroom that they maybe don't know so well, but they knew them just from being by them day to day. And with the population that we serve, some of the barriers that we see, one is really just lack of knowledge, which is why this directory is so great to give people a direct point of access to go look providers in their community, or people that look like them, or people that specialize in certain things such as anxiety or trauma or depression. Because what you don't know, right? And so some people don't realize that it's very accessible to find a provider by going to places like this directory or your local church or your local school or things like that. Another potential barrier is funding. So some people don't have insurance, or they don't know that their insurance covers certain things, especially for people that are on Medicaid. therapy is covered 100%. And a lot of people don't know that because there's this idea that mental health is so expensive. You know what I mean? So I think Amanda does a great job over at Mental Health Blue and letting people know how to access resources and how to make sure that it's paid for so it doesn't prevent you from getting the help that you need. Also, when Mental Health Blue asked me to kind of think about like, why is this important? Why does our community need it? Research shows that one of the most important things about a person in therapy is their relationship with their client. So that person could be the smartest person using the best theory in the world. If they can't connect and build that rapport and have a relationship with their client, the therapeutic journey is only going to go so far. So the benefit of a directory is that you, like I said before, can search by race, you can search by gender, by their specialty, by what zip code they're in. And so it really starts off like personalizing the person you're choosing to be there for you in a time of need. And I'm always an advocate of partnerships. So I love this partnership. Partnership is like at the heart of what I do. And so Amanda and I have partnered on a lot of different things. And I believe that when the community comes together, that's when we make our biggest differences. As a sole provider, I love working with people one-on-one, but some of my greatest accomplishments have been through community partnerships. So I'm so excited to see the city on board with Mental Health Blue and so many providers signing up to make sure that we get the community the help that they need during a very critical time.
And so as you can see, Lauren is one of our providers, and that it's also important for providers to come out of their solo practice. I like to think of Mental Health Blue's directory as a way of not just benefiting the community, but also benefiting providers, in that we are able to help burst the bubbles that we as providers kind of live in and help us connect more with our community and understand our community's needs. And speaking on someone who knows a lot about community and community needs, I would like to introduce T. Gonzalez, who's the director of the Center for Health Equity.
Well, good morning, everyone. Like was said, my name is T. Gonzalez. I'm the director of the Center for Health Equity at the Louisville Metro Department of Public Health and Wellness. Our role at the center is to really be thinking about the ways in which social conditions, social and economic conditions can impact the public's health. And certainly our mental health is not divorced from some of those impacts. While we do not provide mental health services at the department, we know it's critical for us to partner with those who are providing those services and those who are advocating for expansion of those services and greater supports across our community, because your mental health and your physical health are so closely tied together. We know that when we have a better state of mental health and wellness, we're maybe more likely to be able to monitor some of our chronic conditions or prevention of those chronic conditions. There's a cyclical kind of relationship there. So we want to make sure that we're thinking about the health and wellness of the entire person. We know that, as has been discussed, that there are so many systemic barriers to creating positive mental health and well-being in our community. Some of those things have already been discussed. During this pandemic period, we know that so many have experienced great changes when it comes to employment or housing. We've had a lot of stress and trauma related to, the calls for racial justice in our community and that movement. And so we know that we have to be thinking about those things at Public Health and Wellness. The Community Wellness Hub and the Mental Health Provider Directory is a larger part in this community of expanding and really supporting mental health services here in Jefferson County. At the Department of Public Health and Wellness, we're excited that we've been able to secure these $400,000 in federal grant funds through the American Rescue Plan to go towards enhancing mental health services across our community. Mental health services in large part is one of the ways that we can also work towards preventing one of the more serious health outcomes, which could be death by suicide in our community. And we want to take seriously preventing suicide in our community. We know that in 2022, through our coroner data, across residents and non-residents, we had 174 deaths by suicide in our community. We know that loss is too great and it will continue to be felt in this community for a long time. And we want to have a goal of reaching 0 deaths by suicide in this community. And so we need more supports like Mental Health Lou to be able to make sure that all of us are being able to attend to our mental health and wellness needs in this community. And with that, I would like to invite my colleague Ben Goldman up to talk a little bit more about the services and the parts of this initiative that the $400,000 will be funding.
Our team, the Behavioral Health Equity Team, doesn't provide direct services around mental health. Our focus is population level health outcomes around mental health and substance use. So we look at health outcomes and try to identify and address inequities we see mostly related to the root causes of health and the social determinants of health, contributing to inequities in how populations experience mental health and substance use. So this team includes folks working in overdose prevention, suicide prevention, the criminal legal system, and our work around suicide is spearheaded by our suicide prevention specialist, Chelsea Burton, who wasn't able to join us today, but whose hard work is the reason that we have been able to get up and running with this community mental health and wellness hub, and the reason we'll be able to move forward with our additional suicide prevention efforts. The spending package that T mentioned that was supported by the Mayor's Office and Metro Council and the Louisville Accelerator Team targets $400,000 of American Rescue Plan dollars to invest in supporting the mental health of our community and reducing the number of deaths by suicide we see. In addition to the resource hub, it will include a suicide fatality review board that convenes suicidologists and other stakeholders to review every single death by suicide in our county to identify trends, risk factors, and potential interventions, as well as post-interventions after a death by suicide to reduce the risk of additional loss. It'll also include a community prevention plan, building on our success from the COVID-19 community partner work. We've partnered with community agencies that serve populations our department has struggled to reach in the past, including communities of color, immigrant and refugee communities, and the LGBTQ plus communities, and residents with substance use disorder and in recovery for substance use disorder. These are some of the populations where we've seen increases in deaths by suicide. And so rather than us as the government trying to step in and do this work, we recognize there are community partners who are already supporting the mental health of our residents, and that our best path forward is to partner with these trusted community partners, trusted community organizations, and work with them to build additional education opportunities for residents, listen to residents, and have sessions where we hear what folks' struggles are and what kinds of interventions they'd like to see, and then work with these groups to have targeted messaging campaigns. That's the last piece of this suicide prevention project, which is the communications campaign, where we'll be taking the findings from both the Suicide Fatality Review Board and the community partner work to have some messaging around both reducing the stigma of mental health services and reducing the risk of suicide of our residents. The past few years have been hard for most, if not all of us, working in this field and living through the pandemic. There are times that I felt alone and hopeless, but we're not alone, and we don't need to be hopeless. There are many community partners. We are a community filled with providers and community partners who are ready, willing, and able to support our mental health. And we're lucky to have that, and I'm very excited that this project can help bring those providers and those partners a little closer.
So what one will do is head over to our website. So the individual will type in their zip code. They can look by services, they can look by modalities, they can look by insurance, and we have one of the most comprehensive lists of services that you might find on a site like this. So here is information about Amanda. And as we continue to build and bring in more providers, these searches will expand. You'll have more and more providers. And so again, there's Andrew's information and contact. And if, as I said, if people are not able to find the provider that feels like a good fit for them, they're then able to contact us, and we will be the middleman and help find the correct or the best provider for them, and within roughly about a week's turnaround time. Providers submit their information, and then we make sure that the information is accurate, that they are credentialed or licensed before we put their information into our database. We want to make sure that we don't have any providers on there who maybe are listing false information or a false license. There are no guarantees with openings. That is a little bit of hard data to kind of keep updated constantly, because providers would have to actually come to our site and update it. That is actually one of the benefits of us kind of stepping in, is if you contact a provider and the provider you want isn't available for, say, 6 months, you can contact us directly, give us the criteria you're looking for, and then we actually have a network where we go into our network and say who's available, and we can find people more immediately. Thank you all for coming today.